Different people from different backgrounds, coming together on a revolutionary program to bring new nurses into America's healthcare system. This is the success story of the nation's first foreign physician to nursing program at the Florida International University School of Nursing. The story begins in hospitals, doctors' offices, and clinics in many countries around the world. There, hundreds of America's future nurses started on their individual journeys in the healthcare profession as doctors.
I was a physician from Haiti, and I worked there for about 20 years.
Before I left the Philippines, I was actually doing a residency in pediatrics because I've always wanted to work with kids.
I was general practitioner in the Policlinico.
These medical professionals came to the United States hoping to resume their medical careers. Instead, they faced the reality of making a new life outside of the healthcare profession.
When I first came in here, I was not a doctor anymore suddenly, and I couldn't do any of the stuff that I used to do in Haiti. I was not able to care for a patient. I had to do different things to survive.
Well, that was the case, until the Florida International University School of Nursing saw in them an answer to solving one of this country's most critical healthcare staffing needs. Our country's healthcare system has been struggling against a nursing shortage crisis, showing little signs of improvement. The FIU School of Nursing is doing its part to help.
We have an acute and continuing nursing shortage, and this program has produced so far 80 graduates, 80 Bachelor of Science in Nursing registered nurses.
Established in 1982 in Miami, Florida, the FIU School of Nursing is the second largest producer of nurses in the state, offering bachelor's, master's, and doctoral degrees. In its brief history, the school has built a dynamic reputation as a leading innovator of unique nursing programs, helping to solve this country's serious nursing issues. The Foreign Physician to Nursing program is one of these breakthrough solutions. This program utilizes an untapped source of medical skills and talents in the U.S., the foreign-educated physician not practicing in this country.
This program is important because they try to recap your skills, your knowledge, and apply it in nursing career.
To fast-track these potential nurses into the workforce, the school developed an accelerated 18-month program to facilitate the transition from doctor to nurse. Developed in collaboration with Teresa Fernandez, Chief Nursing Officer of Kendall Regional Medical Center, and with the support of Hospital Corporation of America, East Florida Division, Kendall Regional, Cedars Medical Center, and Mercy Hospital, the program was launched in May 2002 and graduated the nation's first foreign physician nurses in December 2003. As these graduates enter the nursing workforce, hospitals are seeing the end results in action, and graduates are seeing their professional opportunities reemerge.
From the first group that graduated from FIU, we had such a vacancy need in our critical care unit that these nurses, we brought them in, put them through our GN internship program, and then put them in a critical care course and put them right out in the critical care unit, and they have just filled the void.
I was working before in surgery, which is totally different from working in a med-surg floor. There's so many things that you can do as a nurse that is unbelievable.
The program is also helping to increase the number of minorities in nursing.
When you look at the entire healthcare workforce, it's not becoming diverse at the same rate as the rest of the country. And so this approach is helping us to develop and educate more minority nurses.
News of this pioneering solution quickly spread across the country, garnering media attention and generating interest from other nursing institutions. The program even received a $1.4 million grant from the U.S. Department of Labor as part of the federal government's High Growth Job Training Initiative.
And the grant was to support admitting another cohort of students. We admitted 90 students, but part of that group involved a distance education segment which was delivered in Orlando. The idea was that if this model could work through distance delivery, then there was potential to replicate it in other parts of the country.
The technology and equipment needed to deliver the program in real time to Orlando was provided by HCA North Florida Division. while Osceola Regional Medical Center and the Central Florida Regional Hospital served as clinical sites for the Orlando students.
Presently, all of the courses are conducted through the long-distance component. The only exception, obviously, are clinicals. We have a faculty member for each class that's lecturing from Miami, and then we're receiving it live. It's not something that's delayed. We actually can participate live in the course.
With long-distance learning, it's pretty much like being in the classroom. And it also has a classroom atmosphere without the professor actually being there. So
we have students that have come as far away as San Diego and Chicago to be in this program here in Orlando, which shows how important it is to them to be able to have something like this available. But ideally, it would be great if these programs were also offered in their communities. It's pretty much limitless as to how much the program can grow.
The FIU School of Nursing continues to work with outside partners for support and funding to meet the growing demand for the program. These partnerships with the community, the healthcare system, and with lawmakers are absolutely essential for the program to reach its full potential. Different people from different backgrounds coming together in a revolutionary nursing education program, telling a story of opportunity.
And it is my hope that this program can be a model for the rest of the country.
Telling a story of success.
It has been such a successful program. I can only speak to the CNOs and just encourage them that it works, it has worked, and we've seen the fruit of this program here at our facility.
And telling a story of hope.
Today, I consider myself a nurse. I consider myself that I'm helping others. I feel good with myself. I know that I'm doing what I always dreamed, and I feel great.
This is the story of the nation's first foreign physician to nursing program at Florida International University School of Nursing.